Good morning or afternoon, depending on where you're joining from today in the country. My name is Tom Coderre, and I'm currently serving as the Acting Deputy Assistant Secretary for Mental Health and Substance Use. I am pleased to be part of the 2021 Law and Mental Health Conference, focusing on reducing the impact of alcohol on states and local governments. I'm humbled to join an agenda that's filled with informative, influential, and inspirational speakers. I began working at SAMHSA back in 2014. From 2014 to 2017, I served as the senior advisor to the administrator and later as chief of staff. A little over a year ago, I became the regional administrator for New England. And on January 20th, I was asked by the Biden administration to serve in the interim period until permanent leadership was appointed at the agency. Dr. Miriam Delphin-Rittman, the former mental health commissioner from the state of Connecticut, has recently been confirmed, and I am now helping her transition to her new role as the next Assistant Secretary for Mental Health and Substance Use. Within the Department of Health and Human Services, SAMHSA leads public health efforts to advance the behavioral health of our nation. We are continuously in pursuit of fulfilling our mission to reduce the impact of substance use and mental illness on America's communities. While we're often known for our grant making, our paramount roles include providing leadership, giving voice to the issues of substance use disorder and mental illness, improving data collection, using data to effect positive change, using surveillance tools like NISDA, the National Survey on Drug Use and Health, educating the public and increasing awareness, providing regulation and setting standards, and finally, providing opportunities and materials for practice improvement. At SAMHSA, we work to help Americans understand that their behavioral health is essential to their overall health, that prevention works, intervention is critical, treatment is effective, and that people can and do recover. I'd like to share a short story with you. It's about a man who, by the time he was 30 years old, was pretty successful by most people's standards. He came from a good, loving family, and he had many friends. He had been employed in nonprofit management and development for many years, and he had risen in his career to become the executive director of a large nonprofit agency. He was also very involved in his community. He had a love of politics, and he was an elected member of the state Senate. On the outside, everything about this man's life looked normal. Some would even say perfect. However, on the inside, he was tortured. So he turned, first to alcohol and then to other drugs to cope with the stresses that he was experiencing. Underestimating the power of these substances and not understanding the consequences of taking them, he quickly became addicted, and his life started this downward spiral. As his life began to unravel, he started to lose the things that were most important to him. When his family and friends tried to help, he resisted their help and he pushed them away. This caused him to lose them. He lost interest in politics. He lost his job and his position in the Senate. His health deteriorated. He lost his apartment and became homeless. He lost his spirit. He lost his freedom. In the end, he lost everything, even his desire to live. This man's life, which at one time was so full of hope, became hopeless. And I know this story well because, as some of you may have guessed, it's mine. But fortunately, I was able to get the help I needed. And while I may be joining you today as the Acting Deputy Assistant Secretary, more importantly, I'm also a person in long-term recovery, which for me means I haven't used alcohol or drugs since May 15th of 2003. And I'm honored to be able to bring my lived experience to leading SAMHSA. You see, I was one of the fortunate ones, one of the roughly 10% of Americans with a substance use disorder who received treatment. In fact, the substance use disorder treatment I received was funded by SAMHSA block grant dollars, and the recovery support I received post-treatment was funded by SAMHSA's discretionary grant program known as the Recovery Community Services Program. People can and do recover. People just like me, and perhaps just like some of you. I mentioned that before serving this role, I served as the regional administrator for New England, or SAMHSA's Region 1. I helped the states in my region respond effectively and compassionately to back-to-back crises. The New England region like other regions, was facing increases in COVID-19 infections, along with spikes in mental illness, substance use, and increases in drug overdoses and suicides. I know the conference this year is being supported by many organizations in Oregon and the Pacific Northwest. I want to give a shout out to our incredible regional administrator for Region 10, David Dickinson. He is a skilled and knowledgeable professional with vast amounts of behavioral health knowledge and can certainly help you, as can all of our RAs, navigate the federal bureaucracy and consult with you on whatever challenges you're having in your state. Please reach out to them. We know that the loosening of alcohol regulations under COVID and the increase in alcohol sales has had an impact. SAMHSA has been given significant resources over the past year to help address that. The Biden-Harris American Rescue Plan, along with other COVID relief bills, nearly tripled the amount of money available to the Substance Abuse Prevention and Treatment Block Grant. These resources are made available to states, and alcohol prevention, treatment, and recovery and prevention are all allowable uses for these funds. Please reach out to your single state agency to find out the best way to access these for your programs. Effective prevention program is critical if we're going to continue to make progress, especially on youth alcohol use. In 2016, I worked with Surgeon General Vivek Murthy on Facing Addiction in America, the Surgeon General's report on alcohol, drugs, and health. The report identified over 60 evidence-based programs that are being used to effectively prevent alcohol use. Other tactics like increases in state and local taxes on alcohol are a simple and effective way to reduce the harm of alcohol. We all know that alcohol regulation happens across the government. We at HHS work with our partners at the FTC, the DOJ, the ATF, and others. SAMHSA leads the Interagency Coordinating Committee for the Prevention of Underage Drinking, which is bringing everyone to the table to commit to doing more. This is key to limiting the alcohol industry's marketing to youth or misrepresenting the contents or character of alcohol. SAMHSA is also committed to recovery housing and scaling up collegiate recovery programs in many public colleges and universities, as we know that this is a particularly at-risk and vulnerable population. To conclude, let me emphasize that SAMHSA is taking quick action to save lives. We will continue to work with our federal partners. We will keep identifying pandemic-related behavioral health needs. We'll carry on with the planning and implementing of new services while encouraging the safe delivery of care. We know that the far-reaching stressors of the pandemic have devastated many Americans and have created unprecedented challenges for the behavioral health providers across our nation. During this time of increased demand and urgency, I want to assure you that funding is in place to help states and territories create more pathways to prevention, intervention, treatment, and recovery services, especially for underserved populations. Together, we must work to restoring our systems and expanding our nation's treatment and recovery support systems permanently. Now, more than ever, these are matters of life and death. Thank you, and have an amazing conference.